Hello, my name is Julie Combs, and I'm a family nurse practitioner who's been employed in the ER for about 2 years now. And before that, I was an emergency department nurse for about 5 years. You've signed up for this course because you're interested in doing clinicals in the emergency room or in working in the ER when you are complete. The purpose of this course is to give you a background of information to start so that way you know of what to expect when you enter into the emergency department, as it's truly a setting that's unlike any other in any of the hospitals or the primary care doctor's offices. This course is going to discuss triage, assessment, some of the common medications, codes, and some different things that you may encounter while in the emergency room. This module in particular is going to cover triage only. Some of the assignments that are included here are some case studies, and there are some self-check quizzes which will keep you on track with your assignments and make sure that you're learning the information appropriately. The objective of this module is to explain the importance of prioritization and levels of the triage protocol, and you should be able to, at the end of this module, provide examples of a chief complaint at each triage level. Triaging in the emergency department is a system where you can assign acuity and resource needs. The treatment would be based on the decline potential of the patient, not a first come, first served basis. It is utilized to enhance patient safety and operational decisions. It's a rapid identification of patients needing immediate interventions. The ESI triage is a 5-level triage system to assign acuity and resource needs. The MCI, which is mass casualty incident, provides triage descriptions based upon likelihood of salvaging the patient versus if the patient is a walking wounded versus if the patient is going to ultimately be non-salvageable, so you should not use the resources on them at that time. This is the ESI triage decision tree. The triage of acuity level 1 is somebody who requires immediate life-saving interventions, such as with a code blue, somebody who's going to be intubated and also be doing CPR. Level 2 is a high-risk situation, such as someone who is having chest pain, shortness of breath, someone you're concerned about a heart attack. Triage acuity level of 3 is somebody who possibly has some danger zone vitals. An example would be a right lower quadrant abdominal pain who is going to need possible CAT scan and also laboratory work. Acuity level 4 is somebody who only requires one intervention, such as a ankle x-ray for an ankle injury concerning for fracture. And an acuity level of 5 is somebody who has no interventions that will be needed, such as somebody who is there for a medication refill. This is the website here, the esitriage.org, so that way you can view those in a little bit more description, which would be beneficial to you. The MCI decision tree is one in which it categorizes patients in a mass casualty incident. A level red is the highest level. It is somebody who does have life-threatening injuries, but they can be saved. A level yellow has non-life-threatening injuries, but they cannot get to the treatment facility on their own. A green level is called the walking wounded. It's the second lowest, and the patients can seek treatment on their own. The black level is somebody who is already deceased or cannot be saved. This triage is one where you want to spend about 30 seconds on each patient, no more, and you want to assess their respirations, their pulse, and mental status changes. This is an area where it's very important to understand there will be grief involved, and also you will need debriefing, as we are taught as nurses to save people, not to let them die. And in these circumstances, sometimes we do have to do that in order to do the most good for the most amount of people. So here are some case study examples. I will let you read over this one, and then the answers will be posted on the discussion board. But I would like you to rationalize why you would assign an acuity level to this patient. This is a second ESI triage case study example. What would you assign this male, and why would you assign him that acuity level? This is one of the MCI case study examples. Based on this case study and your 30-second assessment, what acuity level would you assign this patient? Would he be a red, immediate, or would he be delayed, or would he be dead? And this is a second MCI case study example for you to review. Finally, I will post a self-check assessment quiz on the course page, which will be beneficial to you for you to complete prior to completing the final quiz on triage. Some of the websites are www.esitriage.org and also www.ahrq.gov. Both of these have great information on the description of the ESI and the mass casualty incident triage protocols, their reliability and validity. They've been studied numerous times and proven to be beneficial, and also the ways you categorize patients into these acuity levels and how you can better yourself at becoming a good triage nurse. Triaging is one of the most important parts of the emergency department process because it is when the patient is assigned a level in order to get back to the ER the quickest, in order to determine if they do have life-threatening injuries or symptoms, so that way they can get intervention as quick as possible in order to try to save their life and give them a better quality of life. So this is one of the most important things to understand as an emergency department nurse or student. Here are the websites that I was just telling you about, so that way you see them. You've now completed the module on triage, and I would like you to please complete the self-check practice quiz. You can complete it as many times as possible, and if you have any questions, you can either post them to the discussion board if they are general questions, or you can email me directly. Thank you.